flashlight.
Hello, my name is Reggie Gilstrap. This is my ears, nose, throat, mouth, and sinuses assessment. Here we go. First thing I would do, I would knock on the patient's door. I would then conduct hand hygiene. I would put gloves on. I would then introduce myself to the patient. Hello, ma'am. My name is Joey. I will be your student nurse for the day. Today we're going to conduct a ears, eyes, nose, throat, mouth, and sinus assessment. It'll take about 5 to 10 minutes. Is that okay with you? The first thing I need to do, ma'am, is do you have any allergies?
No.
Also, can you give me your name and date of birth, please?
Bernie Gilstrap, 6/29/89.
Awesome. All right, ma'am. So the first thing I'm going to do is I'm going to assess your eyes, okay? Have you, do you wear contacts or glasses?
No.
Do you have any changes to your vision recently?
No.
Okay. All right. For the purposes of this video, if the patient wore glasses or contacts, we would conduct a Snellen test to identify what their vision was. For the sake of this video, the patient's vision is 20/20. The first thing I will look at is the patient's eyebrows. I will look at them, make sure that they appear normal within reason, and they are symmetrical to the face. There's no lesions, abrasions, or anything of concern. The next thing I would look at is I will pull down the lower eyelids and look at the conjunctiva. It is pink. The cornea is intact. The next thing I'm going to look at is to make sure that the sclera is white, which it is. And then I'm going to test the eyes to make sure that they can follow in the 6 cardinal directions. Ma'am, can you just, without moving your head, just follow with your eyes, please? And then with a pen light, what I would do is I would check to see her reaction, her pupils' reaction, whether they dilate or constrict to light. So I would
It's broken.
close off half her face. I would turn on the light. I would shine it in her eye and make sure that her pupil constricts or dilates. Patient's pupil constricts and then dilates back.
Hold on, please.
Patient's pupil constricts and dilates back.
Hold on, please.
After that, I would be done with the eyes. I would say they were prola with there was no drainage. Next would be the ears. I would look at the patient's ears. I would look at their position on the head. I would say they appear symmetrical. The color is appropriate to the patient's face. I would then palpate the ears. Ma'am, is there any pain when I palpate your ears?
No.
After that, I would then check to see if there was any drainage, which I don't see any drainage. I would then conduct a test to make sure cranial nerve 8 is intact or her acoustic nerve is intact. I'll whisper something in her ear. I'll have her repeat it, and then I'll do it in the other ear.
Go. Chiefs.
So the patient's acoustic nerve is present and it works. That would be all for the ears. The next thing that I would check would be the patient's nose. I would look at it and I would say that the patient's nose is symmetrical. The color of the nose appears appropriate for the patient's face. I would look at the septum and look at the septum. It's not deviated. It's midline and it looks intact. It looks fine. The next thing I would check is the patient's ears. Ma'am, can you plug one of your nostrils, please? All right, can you blow in and out? Can you do it? Patient's ears are patent. She could breathe in and out of each one. The next thing that I would check is I would palpate it. Ma'am, is there any pain?
No.
Patient says there's no pain with palpation on her nose. There's no drainage, any lesions, nothing of concern. The next thing that I would check is the patient's mouth. I would use a tongue depressor, which will be shown as this. Ma'am, can you open your mouth? The first thing that I'm going to check is the patient's lips, tongue, and mucous membranes to make sure they're pink. They are pink. I would look at the patient's teeth. They are white. It appears with no decay. Ma'am, can you say "ah," please? I can see the uvula. Her tonsils are intact, and her nerve is working correctly. The next part that I would do is I will check her. Also, her uvula was midline. The next thing that I would check is her sinuses. I would check her maxilla, and her frontal sinuses, and all I would do is palpate. Ma'am, is there any pain?
No.
Then I would use transillumination by shining a pin light down them. The light would shine through, and that would show that they are clear. After that exam, that is my exam. I would ask the man. I would ask her if she had any concerns or if she needed anything. Ma'am, do you need anything or do you have any concerns?
No.
Okay, I didn't find anything unusual or strange about the assessment. Everything looked good. If you need me, you can call your call light. But if not, it was nice meeting you. Thank you for taking the time out for letting me do the assessment. I will then conduct hand hygiene and walk out of the room.